And be sure to catch their hit series, Juliana and Bill, on the Style Network. Coming up, you'll meet a guest who finally put addiction behind him, only to face the reality of a dangerous side effect many years later. Could it happen to you? That's all next.
So I'm in college now, and I had to make all new friends. I drank a lot. I got in a lot of trouble from drinking. I started using cocaine. The cocaine grabbed me, and it didn't let go.
The following program contains images of an actual surgical procedure that may be graphic and disturbing. Parents are advised that these images may not be suitable for young children.
Could it happen to you? We're talking about conditions that just may take you by surprise. But Jim always knew his cocaine addiction was causing collateral damage. He just didn't know how much.
I always felt like the outsider. I always felt like something wasn't connecting right with me. So one evening I'm at a high school party, about 17 years old, and I had a couple beers, and I found like this is the solution to my problems. I found my way out of my insecurity. So I'm in college now, and I had to make all new friends. I drank a lot. I got in a lot of trouble from drinking. I started using cocaine. It was around a lot more than it had been in high school. The cocaine grabbed me, and it didn't let go. About 13 years ago, I met a drug dealer, and so I now had access to cocaine at any time I wanted it. I was able to call this guy every week, and what turned into a weekly habit turned into a daily habit. At first, I was doing cocaine with my friends. It was kind of the party scene, but it was just a matter of time before I was doing it by myself. My addiction was affecting my life, it was affecting my marriage, it was affecting my relationship with my child, it was affecting my relationships with friends, and most importantly, with my family.
I think the hardest part was just not knowing what to do and still loving him and not wanting to abandon him, but yet I was always begging and trying to encourage him to stop and to get help. I could tell physically he was in pain, and he looked terrible. He was emaciated, and I know mentally he was not there, and he just changed. He was just a different person. He was not the man that I knew. He was almost like a stranger.
So I went in and out of rehab a total of 5 times. So through my recovery, I've been cleaning up the mess, the wreckage of my past. So one of the things that I want to clean up is all the physical damage I've done to myself. I've hit rock bottom, and I know what it's like to be a prisoner to drugs and alcohol. But if I can make it into recovery, anyone can.
I introduced Jim to a colleague, Dr. Calvert, who set out entirely to reconstruct Jim's nose. Let's take a look at what he did.
Well, we're taking out the 8th rib because this gives a large amount of material, and it's fairly easy to harvest. That's actually a pretty good rib.
Yeah.
Now we're going to harvest the 9th rib, make sure that I have the piece I need to hold up the tip. So now we're going to check to see that we didn't get in the chest by filling the wound with water and inflating the lungs.
No bubbles, no injury.
This strut of cartilage will be used for the post that will hold up the tip of the nose. So next I'm going to remove the deep temporalis fascia through a small incision over the right ear. There is no support to the structures left in this nose, so we're going to make stuff to hold it up. I'm going to cut large dorsal reconstruction grafts. They're grafts to make the bridge of the nose, along with some other cartilage grafts which will be designed to keep the tip in position and support the nostrils. These 2 grafts together are going to make the bridge. Now I'm going to burr down the anterior nasal spine. These are going underneath the nasal bones. So I now have reconstructed the bridge of the nose, and I'm going to put in a strut of cartilage to hold it up. I'm going to place that strut in between the 2 bridge reconstruction grafts. And we can really see that there's a nose in here coming out. So next I'm going to lengthen the nose by putting in a columellar strut that will also function to bring the length of the nose down the face. And his cartilage is really behaving nicely for this case. We're really getting a nice reconstruction because the cartilage is cooperating. So this is going to be the nostril reconstruction graft that we're cutting now. Seriously, closing this thing is not going to be easy. This is the dice cartilage. We will take this cartilage and then wrap it in the fascia. So this is the fascia graft. By putting in the fascia with the diced cartilage, we fill all that in and smooth out the bridge of the nose. It's sort of like spackle for the bridge of the nose. So we are going to slide the diced cartilage with fascia graft into position, and this will reconstruct the bridge. The cartilage that we used was really quite good, and the grafts settled in place perfectly. I think Jim's going to be really happy with the results. He's just got to heal it up now.
Amazing stuff, wow. Dr. Jay Calvert and his team. They're all here. Fellow plastic surgeon Dr. Ritu Chopra, who harvested one of Jim's ribs, as well as colleague Dr. Mark Kaim, an otolaryngologist. Welcome to all of you. Just an amazing surgery.
You know, as a plastic surgeon, I can appreciate the complexity of this type of, I mean, truly a total nasal reconstruction. But in your mind, what was the toughest part of this case?
Well, the toughest part is dealing with the soft tissue envelope, the skin and what's left of the lining of the nose, because it's all destroyed. And to really get that to cooperate and to come off of his face was like trying to get brick to move.
See, you have to understand that it's two parts. You lose the inner support, but as part of that, the soft tissue, like you said, the skin itself shrinks down. It's very hard to expand what is essentially scar tissue.
Absolutely, and there's no way to make that work unless you're going to really baby the tissue out and put in the right support, which is why we needed rib. Thanks to Dr. Chopra for helping me out to get that rib out of there.
He's good at finding that rib, isn't he?
He is.
People used to get cartilage from the ear, but it was too flimsy. And now with Dr. Calvert's technique, the rib provides support, and it provides a lot of it.
And Dr. Kaim, when you first saw Jim and looked inside his nose, what was there?
He had a silicone button, a large piece of silicone that was replacing the septum, because the septum had been eroded from previous trauma and the use of cocaine. And there was a lot of infection. We could just see the green drainage and the crusting that was in there. And knowing that Dr. Calvert was going to be putting in a graft, there was the best way to maximize a positive outcome was to make sure that any infection that was there will be cleared out. And so we enlarged the sinuses, removed the chronic infection, and removed that septal button, which was giving him a lot of problems.
Yeah. Dr. Kaim makes a great point. Is getting that pus out of there. Nobody wants to put fresh cartilage grafts into sewage. It's just not good. You know, it's literally what it is. It's terrible.
That was pretty descriptive.
Thank you. I think that brings it home for everybody when you see it that way. Yeah.
Well, and this was not an easy surgery. Is everyone ready to see Jim's new nose?
Yes.
Well, it's been almost 4 weeks since the surgery. Jim, come on out.
So how do you feel? You look great.
I feel great. I really do. I feel wonderful.
And I hope you're not too sore, Jim, because I do want to do this.
That's okay.
I mean, that shot that we did, that Dr. Calvert did in surgery, and then you had no support to your nose. Now that I push, I mean, that nose is not going anywhere.
Right.
That's good.
That's good.
So I want to take a look at the way your nose looked before and compare it to how you look now.
Sure.
So let's take a look. There's your nose before.
Okay.
And side to side.
Oh, wow.
A strong, masculine nose, his own tissue, and still healing.
It's early, but, you know, the structure is there, and probably one more smaller operation later this year to really finish it up, but he's doing, I mean, this guy's incredible.
Your magazine, Renew, is sending a great message, and keep up the good work.
Well, thanks. I appreciate it. We're just, the magazine's really, it's about showing people that recovery is possible. And with over 20 million people living in recovery, I think what better than to have a magazine that could really help them enhance their lives and show them ways that they can improve their lives.
And Jim, you're also standing here before everyone saying, look, if I hadn't done this, I wouldn't be here on stage having to go through all of these procedures, all the pain.
Right.
And so it's the other message there is by bravely coming out here. It's, look, you know, you don't have to go through all of this.
Right.
But if you have struggled, your magazine is about renewing. And I can tell you this, your nose looks like new.
Well, thank you. I appreciate it. I feel great.
Great job, Dr. Calvert. Great job, Doctor. Thanks. Jim, thanks for being here. Coming up, can you fight a life-threatening allergy with the allergy itself? And then later, before you take your next medication, we'll show you how easy it is to pop the wrong pill. Find out if it could happen to you next.